hello, and welcome. You are tuned in to the Fit and Fabulous Health and Wellness Podcast. I am your host, Markeisha, and we're here because guess what? We have questions that need answers. May is Mental Health Month, and today we have a fabulous guest who is an expert in the field of mental health. Dr. Monique Thompson, DHA, LPC, and LPC-S. Dr. Thompson is a seasoned expert in mental health, renowned for her work in building resilience and improving mental wellness among frontline leaders. With a rich 23-year career as a professional counselor, she has conducted over 120 seminars on mental health and wellness. Dr. Thompson specializes in evidence-based coping skills training and is celebrated for her innovative approach to harnessing stress as a powerful tool rather than something to avoid. As an associate faculty member at the University of Phoenix for the past 15 years, Dr. Thompson teaches self-care courses for helping professionals. Her excellence in teaching has earned her the Faculty of the Year nomination for 5 consecutive years. She also serves as a consultant for Southern Methodist University's Perkins School of Theology, a role she has held for 22 years. Additionally, she is the author of the best-selling Infidelity Recovery Workbook for Couples, Tools and Exercises to Rebuild Your Relationship, which has sold over 10,000 copies. She is a member of Alpha Kappa Alpha Sorority Incorporated, Omicron Mu Omega chapter. Dr. Thompson is also a devoted wife and mother of 2. Please join me in welcoming Dr. Monique Thompson.
Thank you.
How are you today?
I'm excited to be here. Such a warm welcome. I feel like we're family now. Well, I guess we kind of are family, aren't we?
We are family. Well, our sorority celebrates mental health in the month of May. And so I wanted to have a conversation around mental health and some of the things that go along with it. And so just to kick us off, basic definition, what is mental health?
So I'm going to make it as plain and simple, just vanilla as I possibly can. No 31 flavors. What I would love for everybody to remember is that when we're talking about mental health, the organ in your body that we're referencing is the brain. So when we say mental health, we're really saying brain health.
Right.
And that kind of helps to clean up everything else that we could possibly be needing. We're not really talking about spiritual health, emotional health, psychological health, financial health, relationship health, or stress, or we are talking about stress. But the brain is an organ, meaning the structures in the brain, the cells in the brain working as it's supposed to work. So taking care of it as an organ, just like you would take care of your skin, you would take care of your heart, you would take care of your liver, your eyes, every organ that you have, there's a prescriptive way of taking good care of that organ. And so thinking of the brain that way, when we think about Mental Health Month, we really could call it Brain Health Month.
Wow, I had never heard of that put in such terms. Yes. Brain health as opposed to mental health. And so why is it so important for us to maintain our mental health for our overall health? Why is it important?
Well, think about it. What organ tells all the other organs what to do? The brain.
The brain.
The brain. Right. So you need the brain to be in tip-top shape because it's telling everything else what to do. So taking care of it is really one of the, if you think about your strategies for health overall, if the one thing that's telling everything else to do it's in good shape, then you have a chance,
Yes.
right? You have a chance of getting the most years out of your body in a healthy way. On the opposite end, if we think about what will happen if you don't, the brain not being in good shape typically means that you're going to have some kind of condition that occurs in the brain and requires treatment. But because the brain is kind of, impaired, it's clocked out of its duties, you're going to have other kinds of issues as well. So you see a lot of comorbidity. You see very difficult to treat mental health conditions because the brain ends up in such disrepair. The metaphor I like for this is a car. If you take care of a car, a little Toyota or something will take you forever. You still see Volkswagen Beetles on the road, right? Um,
Yep.
but if you don't take care of the car, especially if you don't take care of the engine, you can forget about it. You can forget about it. So your engine is the life of the car, and some cars, are very low maintenance, some are high maintenance, but the brain is a mixture of both. It is both low and high maintenance. So taking care of it, it will, in a lot of ways, take care of itself. Not taking care of it, it can have decline and it can decompensate just like any of your other organs. If you don't take care of your gut health, then you're going to have gut issues. If you do not take care of your skin, you're going to have skin issues. If you don't take care of any organ in your body, not taking care of it is causal to a lot of issues. And really, I can't speak for all healthcare providers, but I can tell you that when it comes to brain health, it's so much easier for us to keep you healthy than to return you to health. It is much easier. So Mental Health Month, I'm hoping people will give that message. Take good care of your brain, and it will, one, take good care of you, and two, it is so much easier to keep it healthy than to return to health.
Right. Right. So keep it in that vein. How can I recognize the signs of mental ill health?
Yes. So I'm gonna give you one key symptom,
Okay.
period. All right.
All right.
There's no such thing, period, of anybody having an actual, active episode of any kind of mental health condition, and they're sleeping fine every night, full
Hmm.
7 9 hours, falling asleep with no problem, sleeping through the night, waking up feeling refreshed more mornings than not. There's no such thing. Okay, so
Okay.
one thing to look for is my sleep disturbed? Okay,
Is my sleep
so
disturbed?
is my sleep disturbed? Meaning, am I having trouble falling asleep? Am
Mm-hmm.
I not sleeping through the night? Am I not waking up feeling refreshed? Right? Am I some nights that's happening every once in a while, and I can pinpoint the stressor, meaning I had work I had to get done, I didn't have any choice but to pull all nighter,
Yeah.
or the baby was sick, I had to stay with the child, or I had, there was some identifiable stressor, and then as soon as that stressor was resolved, you went back to going to your
Back to
regular
sleeping.
routine. Right. Then ain't nothing wrong with you. But if you don't have an observable clear stressor and you're having difficulties, that's a time signal to at least do a check-in. I have a checkup, a link in my website to just get a checkup. And the checkup is meant just for that, for me to kind of take a look, listen, figure out if maybe something's going on. The earlier I can find out if there's a problem, the faster we can get it fixed. And then, you're looking at quality of life. And that's a whole long story, right? But your actually health is restored, but quality of life is another matter altogether. But sleep, if you're sleeping fine, you may be mental health wise, you may be okay. Quality of life, maybe you just don't like your job. Maybe it's time for you to potentially, get that degree, or maybe you do want to start walking more so that you can feel better about yourself. But quality of life is different from mental health because we're talking about brain health when we're talking about.
Right. Okay. Now let's switch gears just a little bit and talk about something that everyone wants to know about. And that is two things, depression and anxiety. Are
Wow.
they the same? And what are the differences?
They are related and they play off of each other. Okay. But depression, you can see an episode of depression occurring in the brain. So anybody listening, If you're curious about what does it look like in the brain, just Google images of depression in the brain. I love the pictures that the Mayo Clinic keeps because they keep constant pictures of the brain up, and they clearly show you side by side. Here's the brain having an episode. Here's the brain not having an episode, and you can see the decrease in activity in the prefrontal cortex in the brain is having an active episode of depression, and you can see all of the lights lit up and all the activity level in the brain that does not have an active level of depression happening. So depression is an observable event. You can physically see with your eye on a scan of the brain an episode of depression happening. But here comes anxiety, right? So anxiety is something that is a naturally occurring event. So from birth to when you pass, you have your second breath, your last breath, you're going to experience anxiety. There's 18 different kinds of depression. There are many more kinds of anxiety. But what people usually mean when they are complaining, when they have a medical complaint of anxiety, they mean they have free-floating anxiety, anxiety for no reason, constant worry. They mean that they can't let go of ruminating about spouse or just going and going and going. They may even have what we call anticipatory anxiety. So they're anxious because they are anxious, Well, think of it this way. What goes up must come what? Down.
Down.
Yes. So this is where this relationship ends up happening. So people who have a lot of anxiety, if you think about the 10th floor of a building, if you fall from the 10th floor of a building, it is going to hurt, right? So there's a crash. So you might have a really, really bad mood of deep depression, just an emotional experience after having a lot of anxiety. But if you could just fall off the curb, you might didn't get hurt at all, right? So my rule of thumb for depression is for anxiety, is to keep your level of anxiety throughout your day somewhere between a 0 and 1 on a scale of 0 to 5. Keep it down to 0 to 1. Anxiety responds to self-care. And acute stress anxiety responds to problem solving. So if you can keep yourself in, I'm going to use for your listeners 2 words here to kind of talk about anxiety. One is your parasympathetic nervous system. The other one is your autonomic nervous system. You can move yourself out of anxiety within about 2 minutes.
Okay, and how do we do that?
Well, so to move yourself from anxiety into your parasympathetic nervous system, into a calm state, to your relaxed response, your easiest pathway is to use air. Now, I'm a faith-based counselor. I mean, you mentioned that, work with the theology school. I like this part of it because of the spiritual worldview. When will you not have air? Only one more time. You will always
Right. You
you will
always have
always
air
have
until you
free.
don't.
Until you don't. And then
Yes.
this is none of this is an issue anymore, right? You will
Yes.
always have air until you don't. No matter who you
Right.
are, what station in life, no matter how much you do or don't have in your bank account, whether you are in prison or walking free, you will always have air until you don't. And so it's evenly given. Into every life, a measure of faith is given. It's evenly given. And if you access it, it can help you to reduce your heart rate immediately. It can help you to reduce yourself out of a stress response immediately within 2 minutes. So one quick way for humans, it's just an instinctive prompt, is for you to notice your breath. So I'm going to invite you to just notice your breath.
Right.
And the first thing we do when we just notice our breath is take a breath.
Right. That's exactly what I did. When you said notice your breath, I took a deep breath in and let it out.
Yeah.
Yeah.
It's just an instinctive thing to do, So when you are feeling anxious, just notice your breath. And the first thing you do, it's an instinct. You just take a deep breath and then you just keep going from there. Easily breathing, slowing you down, just noticing your breath. We naturally slow our breathing down. It's just a human thing. So you don't have to go to any fancy class or have an app nearby. All you need is the air that you will always have, right? So after 2 minutes of that kind of breathing, It's the heart
Mhm.
rate that's slowing down, which then
Right.
exits the anxiety. Right. So now you've exited the anxiety. Simple. So anxiety, sometimes you can manage it without medicine, without therapy. But remember that what goes up must come down problem.
Right, right,
If
right.
it's been out of control and it has become a clinical issue, that is the one time that I tell people you have now suffered needlessly. Because anxiety, pretty much any therapist worth their salt can help you with managing that within just a couple of sessions. If it's not traumatic based stress, someone can help you with managing anxiety within just a couple of sessions. If that depression has kind of got mixed in there, now we may be having some problems because remember, that's
Right.
an actual event, right? We got to actually manage that all the way through. But anxiety, you can usually self manage it, can usually be self managed in about 2 minutes. And if you get into the habit of doing it, now this is the other place where brain beauty. Take care of this, take care of it. We create neural pathways and we actually, humans, this is beautiful. We teach our brains what to do. So the most important thing you can do is decide, I don't want to live anxious all day long. I don't want to be. And I'm going to choose not to. I'm going to choose to be calm. Now, I recommend making a clear positive choice versus I don't want to be anxious. Say, I choose to be calm. I choose calm, right? So once you make that choice, you're going to start teaching your brain to do that. And the more you teach it, the better it gets at it. So if you want to be calm all day long, if you keep practicing it, then your brain will learn that's what it's supposed to do. But if you don't practice, if you don't practice and your brain learns to respond with anxiety and with a high alarm to things, you will get very good at that too. Right. And
Is
so it's
that
the
why so many of us, I keep seeing on social media and hearing people say, I have my affirmations that I tell myself and I tell myself this, I tell myself that. Is that a part of practicing better mental health?
that's emotional health. It can help some. But affirmations, I call them like our delicacies. It's a delicate art. Affirmations can be a delicate art. Because you really need authenticity for an affirmation to work. So it's not magic. It's not a spell you're casting on yourself. It really needs to be a deep truth for it to be effective. So one of the challenges with deep truths is that sometimes they're in conflict with each other. Now, I'm going to speak real quick to the married people because one of my specialties is couples. And everybody married will probably identify with your unique ability to love somebody to their toes and for it to almost be over behind their wash machine that you didn't get fixed.
Contradiction, contradiction.
The contradiction, right? So you're feeling both of these things at the same
Strongly and at the same time, okay?
wrong.
I get it.
Only at the same time. So herein is the dilemma with the affirmations because we're going to push the brain into binary, into either or, when the brain in the human life is so complex and it is full of and versus
Mhm.
either or. So my suggestion to people is to throw the word and into your affirmation. So if you're saying to yourself, I choose a healthy life, I choose a healthy life and tolerance of my lack of health. I,
Okay.
I, I choose championing my cause and I choose to coexist with failure. So you're allowing that circle, the full circle, and kind of taking an acceptance and affirming approach to life's natural ups and downs and not believing that what you gonna do? Dodge the raindrops? Choose to accept rain,
Yes.
appreciate it. And the affirmation
Mhm.
is I choose not to be soaking wet. And I acknowledge the rain, which means I'm gonna look in my closet, I'm gonna get a nice raincoat, some boots, an umbrella. And if I have my most beautiful dress that's made of the best silk, I'm going to put it in a box. The box is going in another box that's rainproof. I'm gonna bag the car into the garage and put this rainproof box into the bag. when I get where I'm going, I'm a ballet this day, and I'm gonna take
Mm-hmm.
this box in the cover
Yes.
place inside. So that kind of represents your precious things in life. You cannot stop the rain. You cannot stop the weather in your life. So your affirmation is, I don't need to, you know?
Right, right. Very good. Now
Yeah.
let's pivot and go a little deeper into mental
Okay.
health, right?
Oh,
So we scratched the surface
I
with
don't know how you said that. I
depression.
feel a little scared. Where we go? Can we
Well,
go? Okay, I'm ready. I'm ready.
I'm going to my family, my friends, my colleagues. If I notice that they suffer from a mental illness deeper than depression or anxiety, say schizophrenia, bipolar, on and on and on, what can I do if I see a loved one, a friend, a colleague that exhibits those symptoms, those behaviors?
Fortunately, welcome to 2024. We have nothing but resources. Right? And I'm just going, I've been practicing 23 years, right? 23 years this May. My practice opens in May during Mental Health Month
Mhm.
23. Boy, 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 we didn't have much stuff back then. You had schizophrenia. Really, all you had was hopes and prayers, thoughts, hopes and prayers. If you
Really?
had bipolar disorder, first of all, we weren't even accurately calling it bipolar disorder. We were calling it manic depression, and you were still thoughts and prayers and sorrows. I mean, that's what we had, right?
Wow.
Um, we had not even categorized those as SMI or serious mental illnesses at that time. We didn't have testing available. We didn't have doctors available. We just really, if you have a relative who survived behavioral health care during that time, they're pretty
Wow.
much right there with women who were having babies in the 20s, and you just glad everybody's alive. You just glad
Wow.
people arrived alive, right? So since that time, so much has changed. And one of the things that is accessible and more easily accessible because of the internet is the National Alliance on Mental Illness, NAMI. So if you think that a relative has some of the more significant diagnoses, as you mentioned, schizophrenia, bipolar disorder, or even severe major depressive disorder with psychotic symptoms, those kinds of major disorders, the National Alliance on Mental Illness is where I love to send people, and our sorority has a relationship, a partnership with them.
Yes.
So when you get there, the first thing I want you to do is educate yourself.
Mm.
Educate yourself. And I'm going to be very specific here. I mean, minimally 8 hours of education. So let's
Wow.
say the person has schizophrenia. You're going to go on the National Alliance of Mental Illness. You're going to look up, they have lots of free education in there for family and friends. You're going to educate yourself and maybe just keep a little journal of how much education you have accomplished. They have lots of videos, conferences, workshops, in-person support groups, all that's available to you. After you finish your NAMI, you should take a little walk over to the National Institute of Mental Health, NIMH or NIM. Some people watch that old video, the NIM, the rats of NIM. Anyway, you want to go to National Institute of Mental Health, and I'm sending you to these sites because of credibility, right?
Yes.
If you're out there on TikTok, on Instagram, anywhere on social media, you might happen upon credible information, but you also might not. And in this particular area of mental health, it can do harm for you to be misinformed. Okay. So, like the YouTube University is what I call it, where you kind of YouTube videos
Yeah.
until yeah, so be a little careful over there unless the source of that information is a credible source. National Institute of Mental Health, NAMI, Cleveland Clinic, Mayo Clinic, Harvard Health. Those sites have vetted, information. And so I'd like for families to kind of pick your apples from a good tree, but eat about 8 hours. Eat
Yeah.
about 8 hours. And now you probably have at least a good working knowledge. If it's schizophrenia, those things. If it's bipolar disorder, there is one more site that I recommend, which is BP Hope. It's an online magazine, and that's an easy place to get kind of what do I do about this right now
Uh-huh.
type news articles. How do I manage procrastination, sleep, the mood swings, that kind of thing. So for families, friends, or even actually if the person is lucid, they are aware and they just want to learn more, about 8 hours off a good treat, always. A couple of apples, all you are now is somewhat confused. And, you know, you may have an extra couple extra words, vocabulary words, right?
Right, because when we get a few words, like you say, from YouTube, from social
Yeah.
media, we get a few words from this person or that person, we repeat it, we're not
Mhm.
very well versed on mental illness or mental
Exactly.
health. And
Exactly.
so that's
Exactly.
very rich. You were telling us to go to NAMI, go to NIM, go to
Mhm.
these places. And, really, I never thought of it. 8 hours of learning to
Yes.
really,
Indeed.
really, get into yourself, about the person or yourself if you have those symptoms, your diagnosis. So that's very good. And that leads me to this next question is because, I hear some people say, um, you know, I'm like this because my uncle was like that. My uncle had, schizophrenia. So do I have it? Is mental illness hereditary?
Yes and no. Okay. Um, so and remember all the science I was talking about, how we know things now that we didn't know before. One of the newer areas in behavioral health science is epigenetics. And so there were these studies on the children of Holocaust survivors.
Okay.
They didn't go through the Holocaust, but and on my website, on my little blog, I have a little blog from back in the winter where I talked about epigenetics. So the children of these Holocaust survivors were showing trauma symptoms as if they had also been through the Holocaust. Interesting. So scientists start to research how could children who did not experience something show the symptoms of their fathers or their fathers' fathers. There was a study in Sweden, same thing. These men had survived starvation, and it wasn't their children, it was their children's children were showing symptoms of having gone through this experience. And the
Wow.
epigenetics show that there is evidence that there's DNA passed through the sperm of the father's father. Okay,
Hmm.
so there's that, right? Then we see where when we talked about the brain is that one thing that's telling everything what to do. Okay, so turns out it looks like there's some passing down of neural health, meaning your little baby neurons that need to grow up and reproduce. That's neurogenesis. And you really need all the cells in your body, but obviously your brain cells to really be in good health. And it seems that like some of the health of our brain cells can be inherited. But then when you think about it, you're like, well, that makes sense because you look at people's skin and you're like, oh, look at beautiful skin. It's like, my mama has beautiful skin. You can physically see that, right?
Right.
Or you see somebody's hair and you're like, oh, look at well, of course, look at her hair. Look at her mother's hair, right? Or you know
Right.
how my daddy is bald and he teases all the time, no, you inherit your um bald headedness from your dad. I'm like, I'm not gonna do people but so we can physically see some of the things that we inherit. Well, we only in recent years have been able to literally look at the brain. And so, well, that's not entirely true. We were able to look at it, but communities of scientists weren't able to connect this easily until the internet boom, right? So now there's research communities, ResearchGate, um, academia, the places where we can communicate with each other and it helps information to move fast, right? So there's the news now is that it does look like there is some heritability for certain mental conditions, and the heritability seems to be based on certain structures in the brain, like your amygdala, or two little almond-shaped pieces on either side of your brain. Well, what's the big deal with them? Well, those are your alarm systems. They alert
Hmm.
to things in your environment. And it seems that there's some heritability in that particular alarm system. It seems also that there's some heritability in the actual activity levels of the prefrontal cortex. So there's all this heritability that we see, and unfortunately, we do see this strain, if you will, of certain mental health conditions seeming to pass down through people's generations. So there's some truth to that. But again, the mental health checkup, go get a mental
Mm.
health checkup first of
Right.
all. Secondly, if you're sleeping fine, I cannot emphasize that enough. If you're sleeping fine and you always have been, you're probably okay. You're probably okay. But just still go get a checkup. Go get a checkup and tell people your whole history. I have everybody who comes to see me do an entirely full, excruciatingly detailed history of it. I ask all the questions. I want to know about your adverse childhood events. I want to know your whole everything so that I can see a full picture. But once I can see that full picture, I can kind of see more clearly bad habits from mental conditions, right?
Now let's talk about, since you were
Okay.
saying when they go to the doctor, right?
Hmm.
So we have a mental health issue.
Okay.
Now, who do we go to? Do we go to a psychiatrist? Do we go to a psychologist? Or do we go to a mental health counselor? Can you tell us the difference between the three?
I'm going to tell you the difference between. I'm also going to tell you who you go to first. And it's none of the above.
Okay.
So what do you want first? You want to know the difference between the three, or you want to know who you go
Give
to
me the
first?
difference between the three and then tell
Okay.
us
You
who
might have
you
a
think
little
we should
suspense
go
on
to.
here. Okay. I love this. I love it. Okay. So a little suspense. All right. So the difference between the three is actually really easy. The only one out of that who can prescribe medicine is going to be your medical doctor. All right. You might also have a nurse practitioner who can, help you with medicine. But for prescribing medicine, you have to see an actual MD or someone who's licensed for medications. And even then, depending on what kind of medicine you need, you may have to see a different psychiatrist because some substance control substances, for example, some of the medicines we use to treat ADHD, you have to have your DEA license, right? So you have to see maybe a different psychiatrist. Your psychiatrist is another word for a psychiatrist is a chemist. You need the best neurochemist available for what ails you. Okay, so that's really what you're looking for the psychiatrist. You're looking for someone who can figure out what do we need to do with the brain chemistry? What do we need to do to get these brain cells and these structures back up to health? And that's gonna be the biochemist that's involved with your brain health. That's who your psychiatrist really is. They're not gonna talk to you. I have two who are kind of my favorites because they're still accepting new patients. I have two other ones who were my favorites, but one retired and the other one has her foot out the door. Okay. So, the
So
two
that's a
that yeah,
psychiatrist.
so they're psychiatrists.
Okay.
And anytime I have someone who is troubled with the mental health condition where I know we're going to have to involve a really good psychiatrist, I refer them to that list. And when I tell you we get things done, do you understand? I'm 23 years in. I have never lost
Very
anyone,
good.
anybody. When I tell you I have been on the edge of my seat, like we got everybody sitting on the edge of the seat right now. I have been on the edge of my seat and wondering how we're gonna do this. I have definitely been on the edge of my seat. But boy,
So if you
my
need medicine to balance your
listen, I'm gonna give
brain,
a shout out, Doctor. She gonna heal me. Dr. Sherry Huey U Searles, is
say
she
the
is
name again.
Sherry Huey U Searles. That's her
All
whole name,
right.
Dr. Sherry Huey U Searles. So right here in Dallas, she is just a genius. She's brilliant, but she's also very fast. And sometimes people come, they want what I do. I'm gonna sit here and talk to you and connect with you. We have a little therapeutic alliance. You're gonna see me for 45 minutes. She'll see you for 15 minutes. She's getting in there to find out what's going on. And that's gonna be it. So when you go see your medical doctor, your biochemist, your psychiatrist, you're only gonna see that person for a 15-minute med check. And for some people, it feels like, well, how could they don't know me, they didn't talk. They're listening for the symptoms they need to manage and treat and stabilize, and out you go. Just like going to the optometrist versus the ophthalmologist, right?
Okay, that's another conversation.
That's a whole nother okay, erase the boy with
That's a
back
whole
to
other conversation.
so
So
there's
now that's a psychiatrist. Now the
the
psychologist.
psychologist. The psychologist is a PhD. They have completed additional training beyond their doctoral program in doing clinical work. So they had an intensive internship getting clinical hours, and they passed state boards to become a psychologist. And there's a certain number of clinical instruments that they can use, that they're allowed access to use, that other clinicians cannot use. So very often, here's a place where you might see a psychologist doing their work is when you need to do evaluations and assessments that someone at my level does not have access to those instruments or the training to do. Okay. But they still do therapy sometimes, right? Sometimes they do therapy. They often are going to include in their work, just like a counselor would, a psychiatrist. Like they will refer out to a psychiatrist for the medication management. So when you see a psychologist for therapy, you're getting a therapist who has a PhD. So you're calling them a psychologist because of the credential, the PhD.
So
But
a
they also,
psychologist, the name is the PhD part.
the name is the PhD part. Exactly.
Gotcha.
Exactly. Exactly. Now, everybody else. I'm gonna lump everybody else because everybody else, like licensed clinical social workers, licensed professional counselors, depending on what state you're in, our credential, the name of the credential can change just a little bit. But wherever you go, you're gonna have to have gone through the state boards to get licensed. So if you're in Texas, you went through a state board to get licensed. If you're in Florida, if you're in Arizona, no matter where you are, your master's level clinician had to get licensed. And in Texas, 3,000 hours internship after they graduate a degree.
Whoa.
Honey. So I'm gonna
3,000?
3,000. And when I did it, no, low this many years ago, right? It was 2,000 hours. It is now 3,000.
3,000.
3,000 hours. And when I did it, you had to do your state boards and your hours. Now they have to do a national exam, state board exam, which is close to 3,000 now. So it just has gotten more and more stringent over time. So when you go see someone who has a license, that license is coming from whatever state they are getting their license from, right? So I can see people who are in Texas residents only because I'm only licensed in Texas, right? I have
Gotcha.
my treatment therapy to people who are residents of Texas. But I also like to do life coaching. I can do life coaching no matter where people live because I'm not treating a condition, right? I'm not providing
Right.
mental health care, right? So that's what your therapist can do. Your therapist is, if you're going to see a therapist, they can do life type, work, life coaching type work, but they're trained to treat. We're trained to treat. So we're trained to identify, diagnose, treat, and use evidence-based practices to bring somebody back to health. That is grueling, as you just heard. And I don't
Right.
wish my internship on anybody in the world, not even my own intern. It was grueling. It was absolutely the Lord Jesus. But I appreciate it because I'm fast and I'm accurate. And people get better. I haven't lost anybody, so I have
Very
that.
good. Let me ask you this question because we have the onset of the online generation, and then with COVID, mostly everything was online. How effective first of all, do you treat patients online? And secondly, is it as effective as it is if they come in your office?
Yes, sometimes. Now the irony is my research, I'm a researcher. My research was in
Okay.
telemedicine. And I wanted to know some of those same questions. To answer your first question, though, well, not 100%. I would say 95% of my practice is telemedicine. I go in the
Oh,
office maybe an hour or two a week. Most of the time, not. And I only go in if it is medically necessary. I mean, if there's a clinical necessity to
mm,
me going into the office, I go in because I always like for people to get better, right? So right now I have on my caseload about, maybe a little handful of people who we really need to go into the office. And not all of them need to be seen every week.
hmm
But when we are meeting, we need to be in the office. We try video. I would try it with most people. If it is ineffective, please stop
hmm
because I want you to get better. But as you can hear, 95%, right. So here's some things to look for, like if somebody's wondering whether they should virtual or office. Number one, virtual probably will work for you, and there are hundreds of benefits to doing it virtually. At the top is convenience, accessibility, and consistency. So the convenience is you can do it from literally anywhere, right? The accessibility, you're able to get in to see pretty much any provider now. You can access whoever you want to see. It's rare for a provider to seriously not offer virtual healthcare. Then the consistency. Therapy, if you think about where school day is an easy place for people to see this. There's a scientific reason why we have kids go to school every day and during the time that they go, right? What are we trying to do? We're trying to teach the brain to do something, and repetition matters, right? Similarly with therapy, there's science behind us wanting you to come in for a weekly visit for however many weeks and to do whatever kind of therapy. And getting that consistency is difficult if you gotta add to it, physically getting to somebody's office and then getting back into your everyday life. So moving that barrier out of the way has helped people to be consistent with their therapy and not have these interruptions. And it decreases some of the cost of accessing care. Meaning, if all I have to do is sit down on my couch, it didn't cost me time in my car, I didn't have this commute, I didn't have to wrangle my whole rest of my life around this appointment. So there's the challenge right there. I like telemedicine for most people. I really, really do. Now, who they
Very
should see.
good.
I say you shouldn't even start with any of those three. You ready for the answer?
I never went to back to that.
Gotta
Give us
tell them.
the answer.
Okay. The answer is you should actually start with just family doctor. You should start with your family doctor. Go to your family doctor and tell your family doctor what's been going on. Because remember at the very beginning, we talked about how when the brain is not in the best of health, it may be that there's some other things going on too. Your family doctor actually needs to be your first step. There are so many illnesses that mimic mental health conditions or that cause those mental health conditions to be more severe than they really are. So you go to your family doctor first and tell them, can you do my blood work? Can you check me out? Especially, can you check my gut health? Can you see if I have any vitamin deficiencies, especially like vitamin D? Oh, my Lord. It's so common now, but you know what it mimics? Depression. All right. Do I have anything else going on with women?
Menopause.
Menopause, right. And then if you're having trouble sleeping, I say start with your medical doctor, your family doctor, because your family doctor may realize, okay, really what's wrong? We have sleep apnea that you refuse to get treated. Now you can sleep, and because you haven't been sleeping, now you have what looks like a mental health condition, but actually is you have untreated sleep apnea, and we have to treat the sleep apnea. So that's why I say always start, even for little kids. Like if you have a little kid and you're worried, you're saying you're not sure, first start with the pediatrician. Tell the pediatrician everything and let them first do their step in this process. Okay, so that's who you start with first.
Very good. Very good. I had forgotten, but that was good information. Can you please share a takeaway for people to take better care of the mental health of themselves and their loved ones?
I'm telling you, sleep is your superpower, and there's a TED Talk that I want you to all go watch. Okay, this is a TED Talk. It's called "Sleep is Your Superpower," and watching that TED Talk will make you see a little bit about, okay, I have been taking good care of my brain health, which is my mental health. So start with restoring your sleep, and keep in mind that other things you might be having quality of life issues. And we didn't really talk about that today because we're actually talking about mental health. But your quality of life, your brain is perfectly capable of helping you come up with clever strategies when it has been taken care of. So when you're trying to solve problems in your relationships, you're trying to find out a different financial strategy, if you have not been sleeping well, you are really asking too much. Okay.
Wow.
Not been sleeping well. Because what you're wanting your brain to do is have long-term strategies and manage the stress of sleep. So here's a pop quiz for all the people listening to your thing.
Oh, you have a pop quiz for us.
So there is So there is chess grandmasters do that chess
Okay.
grandmasters do to prepare for chess. Okay? So chess grandmasters do something to prepare for chess, and I'm gonna have to go and give them the answer. What they do to prepare for chess is about 3 hours of intense exercise every day because they need the
3
stamina.
hours.
Yes. Yes. Maurice Ashley was the first Black chess grandmaster. So if they want to do a little Google, look up the interview that he has with Trevor Noah on a chess grandmaster, and they talk about, well, what do chess grandmasters do so that they
Yeah.
can play chess? And he says, well, actually, all of the greats spend hours working out, doing strenuous exercise so that they have the stamina to sit and
Wow.
yes. So for your
3
list,
hours of strenuous
you say
exercise
so.
to
For
be
your,
able to
well,
sit
sit and think. So if
and
they're
think.
taking anything away, it's sleep and exercise. But the kind of
Wow.
exercise for brain health is real exercise. Okay?
Wow.
Yes. Your emotional health, you can take a stroll at sunset. All right. For your brain health, you're gonna have to run. Okay. Take away. All right.
That was a great tidbit. Great tidbit. Well, you gave us a pop quiz, but we do actually have a quiz
Okay.
that all of our guests have taken a quiz. It's called Questions That Need Answers.
Oh my God. Okay.
So this is totally up to you, but we want you to take this quiz. There are 10 questions.
Okay.
You ready to play?
I'm ready. Yes, I'm ready to play. Okay.
Question number 1. A number of factors can contribute to risk for mental illness, such as A, adverse childhood events.
Mm-hmm.
I can't see what B is underneath
Chemical imbalance.
there. C, chronic medical conditions, or D, substance abuse.
It's all of them.
All of the above.
Yeah, it's all of the above.
Great. All of the above.
Yes.
Question number 2. Poor mental health increases the risk for long-lasting or chronic physical conditions like heart disease, cancer, stroke, or all of the above.
All of the above.
That is correct. All of the above. Great. Question number 3. Suicide is the blank leading cause of death among people ages 10 to 24 in the United States.
Oh wow.
Is it
I'm
the
gonna have to
second
get
leading cause of death, the 24th leading cause of death, the 40th cause of leading death, or the 10th cause of leading,
oh
the
my
10th leading
goodness.
cause of death?
I'm gonna say second, but I hate to say that, but I think it's the truth. I just hate that may be true.
Is it A? It is
A. I'm
A.
sorry, A second is the A.
That's correct.
Oh,
You have it correct.
yeah. Okay.
Question number 4.
Okay.
Okay. Half of all mental illnesses occur before a person turns 4
14.
years of 24, 34, or 44.
I'm thinking 14. It could be 24, but usually onset is a little bit earlier than that. So I'm gonna say 14.
Go back to question number 4.
B. I'm sorry, B.
14.
Yes.
14 is correct.
Okay.
That's correct.
Okay.
Number 5. Question number 5. True or false? More than 1 in 5 U.S. adults live with a mental illness.
True.
That is absolutely true. Thank you. Question number 6.
Okay, they see. Over 1 in
Over
5.
1 in 5
Yeah.
youth, either
Yeah.
currently or at some point during your life, have had a seriously debilitating mental illness.
True. Unfortunately, true.
Unfortunately, that is true.
Yes.
That is correct. Serious mental illness costs America how much in lost earnings per year?
Ooh.
193.2 billion, 20 million, 400 billion, or 1 billion?
Ooh, I'm gonna just take a wild, wild guess at this. It's got to be high. See, S in mind. That's okay. Let's say D, but I'm not sure at all. So I'm just gonna guess here D.
It's A,
It was A. Okay.
193.2
$193.2 billion? Oh my God.
billion dollars in
Oh
lost
my.
earnings. Serious mental illness. That's what it costs America. All right, question number 8. About 1 in 25 US adults live with a serious mental illness such as schizophrenia, bipolar disorder, or major depression.
True. True.
That is true. That is true. 1 in 25 adults.
Yeah.
Question 9. Only 1 in 3 African Americans who need mental health care receives it.
True. And I had so much to
Unfortunately,
say. Yeah.
that is true. Unfortunately, that is true. And our final question. In 2020, suicide was the blank leading cause of death, respectively, for Blacks or African Americans ages 15 to 24.
Back in
Was the
2020, I want to say it was first. I think it was first.
In 2020, it was the third leading cause of death.
Yeah, it was in 2020, it was pretty high. I believe that it was either first, second, or third. It's sad, but that's true. So I missed 2. I got 80%. I passed. Okay.
You passed. Thank you so much for participating in our quiz.
Yes.
We have had, thank you so much for our quiz. We have had a great conversation surrounding mental health, what we can do for others, what the differences are between the doctor and the counselors, and how we can treat it thus far. And I just want to say that in African Americans, we need to decrease, remove, eliminate the stigma around mental health and mental illnesses, because in our society we're getting better, but we're not where we need to be at
Right.
in recognizing mental illness, in diagnosing, receiving a diagnosis of mentally ill, and caring for others who are mentally ill. So, what do you say to those people who don't believe that they are mentally ill? The people who they have every known symptom, but they say it's not me issue.
What I say to them? One, I have compassion. And I'm just in case someone is listening this and they're wondering, but they don't want to accept. I have compassion and I understand. I really, really do. And I want whoever that might be to understand that it could be multiple things, not just the one thing. And so it may be that you're not entirely, like, the whole problem may not be the mental illness. It may be a lot of other things going on. But what if we do the one thing, the treatment? What if we do the treatment? Mental health conditions, unless you have a serious mental illness, like we mentioned, bipolar disorder, schizophrenia, major depressive disorder, severe. Unless it's one of those big 3, you could have long ago been treated and been fine. In today's, world of behavioral health medicine, you need a practitioner who knows what they're doing. I will admit that. And unfortunately, people come to me 3rd or 4th therapist down, get to me and say, I wish I had started with you, because I'm like, yeah, we've been finished by now. So I, I understand. I want to normalize for them that your concerns about what they're going to do to help me, there's a legit concern in there, but there's also plenty of well-suited practitioners too. And that's what you get out there and find somebody who can get you from point A to point B, all the way through the alphabet. And if it's a mental health condition, it's treatable. It is treatable, and the suffering is unnecessary. So what if you just got the treatment and you were all better? Because you really can be, at least for the issue, you could be all better. Now, the trifling adult child that won't leave your house probably still going to be sitting there, okay? Be sitting there. Okay, correct. They gonna still be sitting there, and your cousin, they rock your last nerve, constantly asking something and don't never return the favor. She gonna be just as trifling as she was too. But you will have your mental illness and you'll be fine. And when your brain is functioning well, you'll come up with a solution for all of that. And then it'll be even better. So things could be better is what I'm gonna send that message or hope out, that there are people who can do really good treatment. And I'm gonna tell y'all, I'm around whispering. I'll tell y'all a little secret. We know each other. The practitioners who do good work, we know each other. And so if one of us is full, ask us for somebody else's name. That just happened this afternoon. I had a friend reach out to me for a referral, and I was like, what's going on? I reached out to one of my closest colleagues, and I said, I know you're not taking nobody, but I need a favor. And they said,
Right.
all right, what's going on? And they can do the same for me. We know each other. And
Right.
anytime you're seeing somebody, you're not getting better, maybe you need to have a conversation with them first, give them an opportunity. But if you're not getting better from most mental health conditions, if you're not steadily getting a little bit better, have a conversation first. But then, find somebody else. Find somebody else. I have 23 years experience. I'm not the only one. All my close friends have at least as much time as I do. Some of them have more years, more years. And we all know each other. So just like the OBGYNs, when you're looking for a good one and the good one is full, ask her office, who would they refer you to?
Right.
That's how you find the good providers. Your dentist is full. Who is your dentist's best friend?
Right.
Who's your dentist's best friend? That's who you want to go to. Do not go back on the internet streets. Them internet streets will get you. So find somebody
Right.
to ask them for a name. This is still a place where I say ask a few people for a name. You can look on Instagram and you can get to know somebody on social media and feel a comfort zone with them. But this is treatment. Life coaching, totally different story. But for treatment, you actually need a good scientist. And I'm faith-based, but I'm a scientist, and I make sure the science is what we're doing. That's what I have to say to that person. I hope that helps. I know I went on a little bit, but that happens a
Doc-
little. It happens a little.
Dr. Thompson, we really appreciate you coming. Give us one last word and all of your information. How can you be reached? How can we
Okay.
reach out to you just in case we want to see you? Or if you know that good friend that you can refer us to. Last
I tell you
words.
what, last word, my phone number. I'm gonna give my phone number because I feel
Okay.
like generationally, that's easiest. So 972-820-9965, and you can text me. You can text me to that number and tell me what you're looking for, or you can call my website. So now I realize I'm leaving out some of the generations that are, totally silver and gray and totally retired. I'm going to the internet now. My website is drmoniquethompson.com. So Monique, MONIQUE, Thompson with an H and with a P. So THOMPSON, drmoniquethompson.com. That's my website, and there's my phone number. Those are the two easiest ways to reach me. And often, as I was mentioning, the word out to the person, often I get somebody that I realize what you need is not what I have, but I usually have somebody in my literally in my phone that I can help you get to, or find somebody to help you get to somebody, because that's a real challenge when you finally decide you want to go ahead and get some help, and then you go on to McDonald's asking for some ice cream, and y'all know ice cream machine
The ice cream machine is broken.
is
Dr.
yes.
Thompson, it has been a pleasure speaking with you, talking about mental health, mental health, mental health. It's important that we take care of our bodies, but the first part we have to take care of is our brain. Thank you
Yes.
so much for joining us. I am Markeisha, the host of Questions That Need Answers. This has been the Fit and Fabulous Health and Wellness Podcast. Join us next month. June is Men's Health Month, and we're going to be talking to some fabulous, fabulous male doctors. See you soon. Good night.